Everybody, I'm glad you could join me while I'm on my energy drink cleanse. And it got me thinking about self-care. Because usually when I hear people talking about self-care and they say it's for mental health, what they're actually talking about are coping compulsions that make mental health worse. So I wanted to share with you today 3 principles that I would follow to developing a self-care practice that's going to build better mental health instead of fueling mental illness. The first principle is to be proactive when it comes to self-care. Like really go out there and be offensive. Like not offensive like smelly cheese offensive like the opposite of defensive. Attacking. Like really attack with love. Self-care is not a retreat when you run into problems, because if we only engage in self-care as this retreat when we encounter problems, what do we need so that we actually start to take care of ourselves? We need more problems. Like, how much do you actually love something if you only care for it when it breaks and falls apart? So you really have to bring in a practice that is about proactively loving yourself. And so take some time to ask yourself, like, what actions am I going to engage in on a daily basis or a weekly basis or whatever that are about actively caring and loving myself? And how am I going to make sure I follow through on those actions? You got to sustain this. Because otherwise you would just end up back in that old pattern of waiting until you have a problem and then starting to realize you need to take care of yourself. So really think actively about loving yourself. The name of the game here is self-care, not self-repair. There's totally a place in our lives for repair when things happen to us, but we want to get proactive with self-care. The second principle is to have a plan, because we're proactively taking care of ourselves and loving ourselves. We can't just leave that up to chance. It's not just about how do I feel on a particular day. Oh, if I feel good, I'm going to take care of myself. But you would never do that. Like if you had a pet giraffe, you wouldn't just feed the pet giraffe when you felt like it. Right? It's a living organism. Right? It needs a certain level of care, just like you. If you only feed your giraffe on days when you feel like it, your pet giraffe dies. So understand what those activities are that you're going to do to proactively care for yourself and schedule them in. Understand how they connect with the activities you're doing, maybe to push and build your mental health skills. It's a good analogy, an example to follow here is physical fitness. Because when you're building mental health, you're really doing the same stuff you're doing when you're building physical fitness. Right? You're pushing into your limits, you're building new skills and capacity to do things that you haven't done before. Right? That's what mental health, building better mental health is all about. So don't mistake rest for building mental health skills. Right? Rest is probably going to be a big part of your self-care activities, but understand that it's there to support the work you're doing to build mental health skills. Right? Again, think about athletes. You don't just say, I heard athletes have to rest a lot. That rest is really important to being an athlete. So I'm just going to spend a couple more weeks here lounging in my bathrobe, watching Animal Planet, and then I'll be in the Olympics. We follow a structured self-care plan so that we're not just reacting to whatever random brain indigestion pops into our heads. It's going to help you to keep pushing when you feel the urge to stop and avoid and withdraw, even though you don't need to. And then it's also going to help you stop and rest when you feel the urge to keep going and get obsessive. And the third self-care principle is to change stuff. We've got this great proactive self-care practice going on following a structured plan. And what that does is create an awesome base from which to change systems. Change systems inside of us or around us. Right? And that really is the point of doing all of this. The pain, the challenges that we run into in life, they come from somewhere. And so if we can make changes and we don't, then we're part of the problem. Right? If we see that we're engaging in lots of compulsions or we're interacting in a really unhealthy space and we don't work to change that, we just say, oh, this really sucks, I'm going to go have a bubble bath. Well, that's great. Bubble baths are awesome, but that's just a bubble bath. That's not self-care. We're actually participating in perpetuating the problem because we see the problem and then we just go to find relief from it. The problem is still going to be there. Because imagine you've got this car that you really love and you've heard, okay, I should really proactively take care of this car. And so you've got this schedule that you consistently follow. You are putting so much time and energy into that car. But then you keep driving this car past this group of people who throw rocks at your car and they keep wrecking your car and all that care you put into it. Or maybe every time you drive your car, you're always distracting yourself on your phone and you keep getting in car accidents. And so again, all of the care that you invest in the car gets ruined. Or maybe both happens. You keep driving the car into brick walls, and at the same time, then because you drove the car into a brick wall, everybody's throwing rocks at your car. And so again, the car is ruined. Right? And so this is the thing to think about with self-care. Yeah, you can have an awesome self-care practice, but if we don't change the systems around us or change the really unhealthy things we're doing ourselves to create, fuel poor mental health, then all of the self-care is useless. So if you're in the privileged position where nobody is throwing rocks at your car, don't just start driving around being really happy that nobody's wrecking your self-care work. Start to help others. Right? Make the transition from self-care to community care. Because every day, so many people are investing so much time and energy in self-care and trying to take care of their mental health, and yet they interact with a society that's constantly throwing rocks at them, that's constantly wrecking that work. Right? Misogyny, racism, homophobia, transphobia. So many different types of inequalities and oppression are constantly wrecking the work people are doing to take care of their mental health. They're constantly complicating that work. So help to change those systems. Right? We have to make changes in the systems inside of us that are damaging our mental health. We have to make changes in the systems around us that are hurting our mental health, that are hurting the mental health of others. One of the best self-care practices you can bring into your life is caring for your community, right? When we live in healthy, vibrant communities that are welcoming to everybody, that is awesome for everybody's mental health. That brings us to the end. Think critically about your self-care practice. We want something that is supporting you building better mental health, not just another set of compulsions that's going to give you diminishing returns and increased misery. What you can do with the principles that I covered is you can ask yourself, questions about any self-care activity that you're engaging in. So you can really say, like, am I doing this proactively? Right? Or am I just doing this to avoid and control some feeling again? Am I doing this on a structured program, following a plan to improve my mental health? Or again, am I just doing this as a reaction to some problem that's come up? And am I doing this in service of change? Whether that's change in my own life or change in the systems around me or around others. Right? And whatever you end up doing, keep loving yourself. Do that aggressively. Do that all the time. If you want to share about any self-care activities that you found really valuable, throw those in the comments down below.